Welcome to another presentation by My Weight World. The topic of conversation is medication for weight loss, Meridia. The goal of this presentation is to provide a brief overview of the weight loss drug, Meridia. It is not to replace the advice or information you should get from either your pharmacist or doctor. Please consult with your doctor or pharmacist for additional details on this medication. Do not rely solely on this presentation for information on this medication. History. Meridia was approved by the Food and Drug Administration, FDA, in November of 1997. Ironically, in the fall of 1997, two popular weight loss drugs were recalled by the FDA when they were possibly linked to potentially fatal heart valve abnormalities. Fenfluramine, the fen half of the popular fen-phen drug combination, Redux, dexfenfluramine, both removed in the fall of 1997. Technical issues. The generic name of Meridia is Leptos. The active ingredient in Meridia is sibutramine hydrochloride. Meridia requires a prescription from your doctor. Meridia works by acting on the appetite control center in the brain. The active ingredient in Meridia, sibutramine, works in the area of the brain that signals the sense of fullness, also known as satiety. Meridia blocks the reuptake of the brain chemicals, serotonin and norepinephrine, which help regulate the sense of fullness. Fullness is your signal to stop eating. Having a sense of fullness, or satiety, means you may feel satisfied with less food. Meridia does not suppress appetite, which is your signal to start eating. To summarize the key points on how Meridia works, Meridia does not suppress appetite, which is your signal to start eating. Meridia may work by making you feel full and hopefully allowing you to stop eating sooner. Meridia should be used in conjunction with a reduced calorie diet as well as an exercise program. Always consult your physician before beginning any diet or exercise program. Approximately 14 million patients in more than 75 countries have used Meridia for the treatment of obesity since it was approved in 1997. Research studies. Sibutramine, the active ingredient in Meridia, has been extensively evaluated. It has been studied in more than 100 clinical trials involving more than 12,000 patients. Patients treated with Meridia while on a reduced calorie diet showed a significant weight loss during the first 6 months of treatment, and significant weight loss was maintained for 1 year. In one 12-month study, quoted from the manufacturer, patients who took 10 milligrams of Meridia daily lost an average of 10 pounds. Patients who took 15 milligrams of Meridia daily lost an average of 14 pounds. As a comparison, the average weight loss in people on only a reduced calorie diet was 3.5 pounds. How long can you take Meridia for? This is a good question because no long-term studies have been done, at least not beyond a year. Is this just then a short-term drug? More studies are needed to show that the drug is both safe and effective beyond a year. For now, it is up to your doctor on how long you can take the drug. Indications. This drug is for the purposes of treating obesity, therefore only people with a BMI of 30 or 27 in the presence of other risk factors such as diabetes or high blood pressure should be taking this drug. Ideally, taking Meridia in conjunction with a reduced calorie diet and appropriate physical activity may be beneficial as opposed to just taking Meridia. Please consult with your physician. Exclusions. Meridia is not indicated under the following circumstances: someone who does not meet the weight criteria, someone who is under the age of 16, certain medical conditions, consult with your doctor, including at least poorly controlled blood pressure, other medical conditions, patients who are taking prescription medicines called monoamine oxidase inhibitors, Other weight loss medications that act on the brain, for example, phentermine. This includes prescription and over-the-counter medications that act on the brain. Patients who have had prior allergic reactions to Meridia or sibutramine. In studies, the most common side effects were dry mouth, constipation, insomnia, inability to fall asleep, increased sweating, an increased blood pressure, and an increase in heart rate. These side effects are generally mild and have usually not caused people to stop taking Meridia. If you develop a symptom that you think might be a side effect, stop taking Meridia and notify your doctor immediately, so he or she can advise you on what to do. Alcohol. Meridia may increase the sedative effects of alcohol. Consult with your doctor before drinking while taking Meridia. Caffeinated beverages. Meridia can be safely taken with moderate use of coffee, tea, or caffeinated beverages. You should check with your doctor if you consume a great deal of caffeinated beverages or use over-the-counter pills that contain caffeine before taking Meridia. Driving a car. Meridia should not interfere with your ability to drive your car. However, you should be on the alert for any signs of fatigue, sedation, or lack of alertness. You should be very careful about using alcohol before you drive, as Meridia may increase the sedative effects of alcohol, as previously noted. Summary. Meridia. For most people, this can be a safe weight loss drug. Weight loss in one study averaged between 10 to 14 pounds, depending on the dosage of the drug. Safety and effectiveness beyond 1 year needs to be shown. Some side effects similar to any other drug. Consult with your doctor or pharmacist about any issues with Meridia or any other drug. This has been another presentation by My Weight World.